Welcome to the Healthy Lifestyle Podcast, brought to you by Telehealth FX, your source for online GLP-1 weight loss and testosterone replacement therapy services. Visit telehealthfx.com to get medically guided access to weight loss peptides like semaglutide and tirzepatide delivered right to your home. That's telehealthfx.com. Now, here's your hosts.
I want to start today with a phrase that sounds like marketing fluff, but is actually the most important two words in this entire industry right now: physician supervised.
And I know how that sounds. Every website says it. It's on every banner ad. It's become one of those phrases your eyes just slide past.
Right, but here's what changed. That phrase used to be a nice to have. In 2026, it's become the line between medical care and something that just looks like medical care from the outside.
So that's today's episode. What does physician-supervised weight loss actually mean? What does a real one look like versus one that's just using the words? Why the ground shifted under this industry this year? And how you can tell the difference before you hand anybody your credit card.
And if you've been listening the last couple weeks, this is the natural next step. We covered whether medical weight loss is worth it, then what it actually costs. Now you know it works, you know your budget. This is the episode about not getting burned.
Usual reminder first. This is educational content, not medical advice. We're two people who read a lot of research. Your provider is the one who knows your history, your labs, and your medications. Every decision here belongs in that conversation.
Okay, let's define the term properly, because the definition is doing a lot of work. Physician-supervised weight loss means a licensed medical provider, a physician, a nurse practitioner, or a physician assistant, evaluates you, makes a clinical decision about your treatment, and stays involved while you're on it.
3 parts. Evaluates, decides, stays involved.
And that third one is where almost everything falls apart. Because plenty of operations do a version of parts 1 and 2. Somebody reviews a form, a prescription gets generated, and then you're on your own with a medication that changes how your body regulates hunger and blood sugar.
That's the piece I want listeners to really hear. Supervision is not the moment you get the prescription. Supervision is everything after.
Which brings us to why this got so urgent this year. Because the regulatory ground genuinely shifted underneath this whole industry in 2026, and most people have no idea.
Give people the short version, because it's a little wonky, but it matters enormously.
Okay, so when these medications first exploded in popularity, demand outran supply. There was an official shortage, and under specific rules, when a drug is in shortage, compounding pharmacies are allowed to make their own versions to fill the gap. That's how a whole industry of compounded semaglutide and tirzepatide sprang up, and at the peak in 2024, compounded versions were estimated to account for roughly 30% of the supply in the United States.
A third of the market. That's not a niche.
Not at all. But then the shortage resolved. The manufacturers scaled up, and in April of 2026, the FDA proposed excluding semaglutide, tirzepatide, and liraglutide from what's called the 503B bulks list. In plain English, that's the list that lets large outsourcing facilities compound a drug in bulk. The FDA's reasoning was essentially, there are approved versions available now. They work. So there's no clinical need for industrial-scale copies.
And notably, the FDA specifically said that affordability and insurance access, as real as those problems are, don't count as clinical need under the law. Different problem, different tools.
Which is a genuinely tough thing for patients caught in the middle. But here's the safety context that explains why regulators pushed. FDA safety data has documented over 100 hospitalizations and at least 10 deaths connected to compounded semaglutide, and the primary cause was dosing errors.
Dosing errors. Not the molecule being dangerous, people getting the wrong amount.
That's the crucial distinction, and I want to be careful here because we don't do fear-mongering on this show. The medication itself has excellent trial data behind it. The problem was that compounded products came in different concentrations than the branded pens people were used to, sometimes measured in units instead of milligrams, and people drawing up their own doses at home with close medical guidance made math errors. Some of those errors were serious.
And that is the single best argument for supervision anyone could construct. It's not a philosophical argument, it's not marketing. It's what actually went wrong when supervision was thin.
There's more context too. The FDA sent warning letters to dozens of telehealth companies, including a batch to 30 firms, over claims that compounded versions were identical to the branded drugs. They're not. Compounded products don't go through FDA review for safety, efficacy, and quality. And there's been litigation alleging that some compounded semaglutide contains significant impurities.
So let's translate all of that into what a listener should do with it, because I don't want anyone panicking. If you're currently on a compounded medication through a program, what's the move?
Not panic. Ask questions. Talk to your provider and specifically ask, where is my medication compounded? Is that pharmacy licensed and accredited? And what is my transition plan if the rules change again? A good provider has an answer ready. And to be clear, Narrow patient-specific compounding at what are called 503A pharmacies remains legal in situations where there's a documented individual need. This isn't a story about everything disappearing overnight. It's a story about the Wild West era ending and the real medical providers being the ones left standing.
All right, myth busting. Myth number 1, and this is the big one. Online means unsupervised.
Completely false. And I want to push back hard on this because it hurts people. Telehealth is a delivery method, not a quality level. There are telehealth programs with more rigorous supervision than some in-person cash pay clinics, and there are in-person clinics that are basically vending machines.
Today's episode is brought to you by Telehealth FX, your source for online GLP-1 weight loss and testosterone replacement therapy services. Visit telehealthfx.com to get medically guided access to weight loss peptides like semaglutide and tirzepatide delivered right to your home. That's telehealthfx.com. Now back to the show.
With a waiting room. The question is never online versus office. The question is there a licensed provider who evaluated me and who I can actually reach on Tuesday when I have a question?
And honestly, telehealth solved a real access problem. If you're a shift worker, a parent with 3 kids, or you live 2 hours from the nearest specialty clinic, the office visit model was the barrier. Consistency drives results, and convenience drives consistency.
Myth 2. If a real doctor's name is on the website, it's supervised.
Ooh, this one's sneaky. Some operations have a medical director whose name appears in the footer and who has essentially no involvement in your individual care. The test isn't whether a physician exists somewhere in the org chart. The test is whether a licensed provider reviewed your specific health history, made a decision about your specific treatment, and is monitoring your specific response.
Myth 3. Supervision is just an upsell to justify a higher price.
I understand the cynicism, but the outcome data doesn't support it. Remember from our first episode, in every major trial, the medication was paired with clinical support. That's the condition under which those 15 to 20% weight loss results were produced. Nobody has ever run a study showing you get those results from a prescription and silence. And supervision is what catches the things you can't catch yourself. Muscle loss, nutrient gaps, a blood pressure medication that now needs adjusting because you've lost weight.
That last one is so underrated. As you lose weight, other medications may need to change. Blood pressure medication, diabetes medication, sometimes others. Who's watching that if nobody's watching you?
Nobody. That's the answer. Nobody's watching.
Okay, practical segment, and this is the heart of the episode. How does a normal person tell a real physician-supervised program from a costume? Give me the checklist.
Here we go. Marker 1. A real medical evaluation before any prescription exists. Your health history, your current medications, your labs when appropriate. If a site can move you from landing page to checkout in 4 minutes with no provider interaction, that is not medicine.
Marker 2. A named licensed provider you can actually reach. Not a chatbot, not a generic support inbox. A clinician who can answer a question about your body.
Marker 3. Scheduled follow-ups built into the program. Not optional, not an add-on. Regular check-ins where somebody is actually looking at how you're responding and adjusting.
Marker 4. Pharmacy transparency. Ask where your medication comes from. A legitimate program will tell you, and will tell you whether it's a brand name product or compounded, and if compounded, what pharmacy and what accreditation. Evasiveness here is the reddest flag in the entire industry.
Marker 5. Lifestyle support that's actually integrated. Nutrition guidance, protein targets, muscle preservation, movement. Because the medication opens the window and the habits are what keep it open.
Marker 6. Honest, boring claims. No guaranteed pounds by a date. No before and afters that look like different people. No language telling you a compounded product is identical to a branded one because the FDA has specifically gone after that claim.
And marker 7, the tiebreaker. Are they willing to tell you no? A real medical provider will decline to prescribe when it isn't appropriate. If a program's answer is always yes, they're not screening you. They're selling to you.
That might be the truest thing we've said on this show. A provider who can't say no isn't a provider.
And that's exactly why we're comfortable with the folks who help make this show possible. Telehealth FX is built on the medically guided model we've been describing all episode. Licensed providers, a real evaluation of your health history, prescriptions only when clinically appropriate, and ongoing support throughout, all from home. If you've done your homework, you know it works, you know your budget, and now you just want a program that does supervision properly, go to telehealthfx.com and see if it's the right fit for you.
Let's do common mistakes, because even people who choose well can stumble here.
Mistake 1, going quiet. Your provider can only supervise what they know about. If you're nauseous, if you've stopped, if you're skipping doses, if you're struggling, tell them. Half the value of supervision evaporates when patients hide the hard parts out of embarrassment.
There's no judgment on the other end of that conversation. They have heard it all, I promise you.
Mistake 2, drifting into the DIY spiral. Somebody hits a plateau, they get impatient, and they start adjusting things on their own or buying from a cheaper source they found online. That's how the dosing errors we talked about happen. Bring the plateau to your provider. Plateaus are normal, and they have actual clinical answers.
Myth 3, skipping follow-ups once things are going well. Feeling great is exactly when supervision is doing its job. That's not the moment to stop showing up.
And mistake 4, buying from any source that doesn't involve a licensed provider at all. Social media sellers, peptide sites, gray market vials, please, no. That's where the hospitalizations came from. Whatever you save is not worth what you're risking.
And the nuance we always honor here. Not everyone needs medication at all. Some people do beautifully with structured lifestyle change. Some people are better served talking with their doctor about surgical options. Some people aren't candidates for these medications for real medical reasons. And a supervising provider is exactly who identifies that. The supervision is the value. The prescription is just one possible output of it.
If this helped you feel more confident about how to evaluate a program, share it with someone who's currently comparing tabs and can't tell which ones are real.
And drop a comment. What red flags have you spotted out there? What questions do you still have about vetting a program? You all catch things we miss, and it makes this community sharper.
All right, 3 key takeaways. Number 1, physician supervised means 3 things, not 1. A real evaluation, a real clinical decision, and real ongoing involvement. The third part is where the value lives and where most operations fail.
Number 2, the industry genuinely changed in 2026. The FDA moved to close large-scale compounding of these medications after safety data linked compounded semaglutide to over 100 hospitalizations and at least 10 deaths, mostly from dosing errors, and sent warning letters to dozens of telehealth firms. Supervision isn't a nice-to-have anymore. It's the thing that separates medicine from risk.
Number 3, online doesn't mean unsupervised, and in-person doesn't mean supervised. Judge programs by the 7 markers: real evaluation, reachable provider, built-in follow-ups, pharmacy transparency, integrated lifestyle support, honest claims, and the willingness to tell you no.
And your one action step for this week. Take whatever program you're considering and send them one question. Ask, who is the licensed provider who will be reviewing my care, and how often will I actually talk with them? That's it. One email, one chat message. The speed, clarity, and specificity of that answer will tell you almost everything you need to know.
A clear answer is a green light. A vague one is your answer too.
Remember, this episode is educational content, not medical advice. Talk with...
Thanks for listening. Be sure to visit our sponsor, Telehealth FX, your source for online GLP-1 weight loss and testosterone replacement therapy services. Go to telehealthfx.com to get medically guided access to weight loss peptides like semaglutide and tirzepatide delivered right to your home. That's telehealthfx.com. See you next time.